This is Going Under, Anesthesia Answered with Dr. Brian Schmutzler. I'm Vahid Sadrzadeh. We're brought to you by the Butterfly Network.
Yes, we are. All right, I'm going to let you in on something that's completely changed the way I practice. I've been using butterfly probes for years. It's a portable ultrasound that plugs into my compatible smartphone or tablet so I can start scanning bedside in minutes. If you've used the older versions, or even if you're new to handheld ultrasound, let me tell you why this new IQ3 is a game changer and really impressive. First off, having an ultrasound that literally fits in my pocket or in my butterfly belt bag at this
Satchel?
point. Yes, butterfly belt bag.
Belt bag.
Means I can move faster, whether it's vascular access, procedural guidance, or just getting real-time insights from my patients. And the tech inside this tiny device is pretty incredible. Biplane imaging lets me see short and long axis simultaneously, which is huge for procedural guidance and also great for teaching some learners that work with us from time to time. The new needle out of plane preset even shifts the scan plane digitally so I can see the needle tip sooner, which makes a real difference when precision matters. And the image quality, honestly, the IQ3 holds up against all the high-end cart-based products that I've used in the past. If you're looking for a device that supports your practice, I can't recommend the Butterfly IQ3 enough. And right now, they're running a special offer. You can get $750 off the latest IQ3. Check it out at butterflynetwork.com. And what's my code again?
Brian25?
Brian25.
Got it. At least I remember that one.
Got it.
Shout out to Fabletics. I really like this color, by the way. What is it called? Is it called
Desert, I think?
Desert
Desert sand, something like that.
I like it. Right up my alley. So big thank you to Butterfly Network. Hope everybody has had a great summer so far. How has your summer been?
Busy.
Yeah.
Lots of traveling. Lots of working.
I bet.
Just started football, so it's keeping me busy now.
Coach Schmutzler.
Coach, yes. Call me Coach.
Coach, how are the Eagles looking this year?
Looking good.
Okay.
Looking good. 2 solid practices so far.
Nice.
We're coming after your Raiders.
Hey, listen.
Oh, yeah.
The Raiders are stacked this year.
Wow. Wow. Yeah. And you guys practice. What's funny is you practice about 5 minutes from my house, and I practice about 10 minutes from your house, except we have to
travel 35
minutes each way. Yeah. So
that's a bummer.
Fun.
So today, kind of an impromptu, let's get together. Let's see how the state of medicine is in 2025. I know we made our predictions a while ago, but let's see, maybe are they coming to fruition? Are they not? What's the state of medicine? We're going to talk about 2 subjects in particular, and then kind of going to give you the layout of what's happening for this year with us in the fall. First of all, we're going to touch on the
that's how you pronounce it.
Chikungunya virus, which is the latest outbreak in China. Yeah. True or false, we should be worried.
So everything I've read, it's contagious, but not
coronavirus.
Yeah, it's probably not the same contagious level as coronavirus, but also it's nowhere near as deadly. So it's like 0.01%. Fatality rate. There does seem to be a bit of morbidity with it. So you get the typical prodrome, which is high fever, severe joint pain, fatigue, and rash. And then oftentimes many of these symptoms can last to some degree for a long time. So it's almost like, we talk about long COVID, whatever you think about that. Comes from mosquitoes. I don't know. There's some person-to-person transmission. It's a fancy headline. I don't think this is going to turn into anything too crazy, but I'm sure there's going to be all kinds of lockdowns and stuff in China. So
I was literally about to ask, do you think there'd be any lockdowns
in China? No,
in the United States?
It's not happening in the U.S. I doubt it. And so let's see. I guess it's been around for 20 years or something, but there's been 240,000 cases. Across 16 countries.
That's pretty big.
Yeah, they have a couple of vaccines, but nobody gets them.
Okay.
And then they're using mosquito-eating mosquitoes to control it. So it's only one type of mosquito. And I'm not a a bug specialist, but there's some sort of mosquito that eats the mosquito that passes along the disease. And so they're releasing these mosquitoes that eat the bad mosquitoes
into the wild.
Yeah.
And what do those mosquitoes carry?
Who knows,
That's the question, right?
Then there's some sprays that you can do for it, and there's some conservative treatment stuff, but
nothing to be
I'm not worried. I don't think that, at least based on everything that's showing up now, it suck if you get it. Like it's no fun. Headache, fever, rash, joint pain. Although that's like being 40, so whatever.
That's what I experience every morning.
Every morning,
getting out of bed.
Do I have the Chikungunya virus, or am I just 40? So.
No, yeah.
Yeah.
That's what I ask myself every day if I can pronounce it.
Yeah,
it's a difficult one to pronounce.
Yeah, I mean, I don't know. They find that there are quite a few places in China that and all over the Southeast Asia, where from the tsunami that happened and all the additional water, apparently the mosquitoes breed in that type of water, whatever, the Pacific Ocean, brackish, whatever type of water. So they're getting more and more cases now, which is they think it's from, the tsunami and all the stuff that happened with that. So you'd imagine that if that's the case, it's going to go back down once all that stuff sort of resolves.
So on that one is probably false. Reason to be concerned.
No. Yeah. I give it a less than 1% chance that this turns into anything serious.
Okay. Let's continue the quick hitters here.
Right.
True or false? Trump bring back the fitness test is good for kids and America.
True. I love it.
Okay.
I love it. I'm not sure why we got rid of it. We got rid of it like 15 years ago, 2012.
Oh, so it was. I thought it was a way long time ago.
No. And I've got it here. So you do a 1 mile run, and when I did it, you had to do the mile in under 6 minutes.
Wait, what did this is elementary school, college,
all
high
the way
school?
through elementary, middle school. I think even high school.
Okay.
Yeah.
I had a fitness test in high school for sure.
Yeah, I think it's even high school. Yeah. So one 1 mile run under 6 minutes, max sit-ups in a minute. Push-ups or pull-ups, depending on whether you have a
This is right up your alley.
Oh, yeah. Flexibility testing, which is not right up my alley. You're supposed to be able to bend over and touch your toes, and then sitting be able to touch your toes. And then a shuttle run.
Okay.
So, yeah, all timed, and there's certain, like, benchmarks that you have to do and stuff. And then they used to, I don't know if you remember this, like in gym class in middle school, did they do fat testing? Did you ever have that done?
I don't think so.
We had that done in middle school.
You did?
Oh, yeah, like the calipers.
Oh, like they...
Yeah, they'd fat test you. Yeah.
That's a football thing, right?
In front of everybody. Yeah. But they did it in middle school, just gym, PE class.
So it has been reinstated, by the way, immediately, effective July 31st.
Yep.
And it states that... so they'll introduce a presidential fitness award, which they had before, by high school and education departments beginning next year. So really the reason for this is childhood obesity, inactivity, and poor nutrition, which is what we kind of talked about with the BBB, the Big Beautiful Bill. So is it a surprise that this is coming out right after the Big Beautiful Bill?
No, I don't think so. I mean, Trump listens to that other person who serves as the HHS secretary.
Here's my question for this, though. So, supporters praise its tradition.
Yeah.
Critics are worried about psychological stress, body shaming, and return to competitive fitness. What are we hoping to gain out of these? I think that's the ultimate question that people are asking is, what are we gaining from this?
So, I don't think the test itself is what matters. It's that in gym class or PE or whatever, they make you train for it. You don't just go out and do it on.
You're not just pushing a balloon up. Go under it.
Yeah, exactly. No, you're not just going out and doing this test. They spend several weeks helping you train for it, which is improving physical fitness.
Sure.
And then in the meantime, you talk about like, hey, if you're physically fit, not only do you do this fitness test, but also you eat well and, you don't sit in front of the TV all day long and all that kind of stuff.
And what about the opposite? What about reaping the benefits of physical activity, which is, stress?
Yeah, stress relief, reduce weight, longevity, all kinds of stuff. I mean, exercise is like the...
So why did they get rid of it in the first place? Do we know why?
But they just said it made people feel bad.
Critics?
It made people feel bad. Psychological stress, whatever, competitive fitness.
Unpopular opinion. There are no participation awards. This is just the old school where I'm from, okay?
Yeah.
Now I sound like a boomer.
Clearly you're not a millennial. Yeah, clearly not a millennial.
I'm just saying no participation awards. Obviously there's winners and losers, but there's good in that, right? I mean, like we came up in the age where you got hit in the mouth and you go back and you do it, right?
Yep.
And I'm talking about physical fitness. I'm not talking about anything else. So when you're talking about physical fitness, well, it's a pride thing, right? I mean, you take pride in it. We realize that everybody's not the same, and that's okay. But I don't see anything wrong with it.
No. I mean, competition's good, right? And especially middle schoolers, right? They're always in competition. Like, my dad's stronger than your dad, or, my applesauce tastes better than your applesauce. Like, why not make it something that's actually somewhat valuable to people? And then in the real world, nobody gives you a participation trophy. If you show up to work late, your boss is not like, oh, thanks so much for just coming in today.
Yeah.
No, why did you show up late? Get to work. Right?
Accountability
exactly.
Is the number one word.
Yeah.
And so that leads me to my third and final question.
Yeah.
Which is true or false? The state of medicine in 2025 has improved.
That's interesting.
It's a general question, but
so do I think people are getting healthier in 2025? No, I think they continue to get less healthy. Do I think that having disruptors in the government at the federal, state, and local level is sort of breaking up some of these things that are probably causing us not to be healthy, meaning that our food is poison, that we sit in front of a TV all day long, that we, again, the physical fitness thing, like you're pushing physical fitness. This is something you need to do to stay healthy. I think that's potentially improving.
Okay.
I think AI
is helping medicine.
I do. Yeah. I think for sure AI is continuing to help medicine. I think it's improving diagnosis, potentially improving treatment, improving access for sure. I think it's improving the lives of clinicians. The AI-based scribe stuff is huge. There's a lot of AI-based stuff now. So
we've talked a lot about
marginally improving.
We've talked a lot about AI where, and I don't know, did we talk to Zane about this, or I can't remember, but essentially where they can control surgery from another city or a country.
Yeah, robotic surgery.
I think that was ASMBS that we were talking about that. That they can do robotic surgery from, overseas.
Right.
And still have control, and, talking about the AI improvements and the lag time and all that stuff. Ultimately, if you're looking ahead to 2055 or 2075, right, is this, and our kids are running the country, is this good for medicine to have that type of capability? Are we ever going to get to a point where doctors are obsolete?
No, I don't think so.
Where the robots are doing surgery for us.
Yeah, there's probably going to be
And is that a good thing?
There's some degree of automation or, robots doing surgery. You're still not going to... I don't know that the general public is going to accept that a robot with no physician present is doing their surgery or doing their anesthesia. AI is probably going to be a problem for primary care docs where it's strictly diagnosis and very little treatment, or at least not acute treatment.
Sure.
It's sort of chronic treatment. And it's already a problem for radiology because AI is reading a huge portion of
it. Is okay. I didn't know that.
Oh yeah, of the scans, but with backup of a physician. So, again, we talk all the time access, right? We don't have enough physicians. We don't have enough clinicians. We don't have enough people to handle all of the people who need care. So, if it works the way that automation worked in, the auto industry, the manufacturing industry, it's going to create different jobs or different ways to do your jobs. I don't think it's going to eliminate the majority of anything that you actually have to do with your hands. I don't think it's going to eliminate things like, and we've talked about this before, contract attorneys, any attorney aside from litigation. It's a decent chance that a bot can, if the bot's
do the job
good enough, it can write a contract, it can redline a contract, it can tell you everything you need to know about a contract. So,
well, look at the race with Meta, right?
Yeah.
What tells you more than Mark Zuckerberg just signing on a 21-year-old to a $250 million contract.
Yeah.
You know,
To
I mean,
do AI,
the race war for AI.
Yep.
The race for AI is a war right now.
Yeah.
And so it is pretty, unprecedented where we're headed. I agree with you. I don't think it's ever going to change that. Primary care, to me, is already kind of, I don't know, like without AI is kind of in trouble, like what we've been talking about.
Yeah. Oh, yeah. For sure.
So you introduce AI and people are already thirsting for knowledge.
Right.
Meaning when you're sick, you want that.
Yeah, you look online. Yep. Oh, yeah.
You look online.
Dr. Google.
Yep. You're your own worst doctor.
Yep.
Right. But what I think Butterfly does well, and this is a shout out to Butterfly.
Shameless plug. Yeah. Right.
But seriously, what they're doing well is they're trying to get these devices into the hands of people who don't have access to medicine.
Correct.
So you're 400 miles away.
Yeah.
From the nearest hospital.
Yeah, or the nearest physician.
From the nearest, the nearest doctor. Why aren't we utilizing that with AI with medicine right now? Like, why aren't we saying, hey, people in far reaches of Africa or South America or Asia or Alaska, why aren't we giving them the tools to this AI technology now so they can be better equipped to handle stuff like this?
I think it's new enough. We don't know what we don't know. So if we just send it out there and say, hey, whoever in the middle of nowhere, Africa, just use this thing and figure out how to use it. I think we don't know what we don't know. So we don't know how accurate they're going to be, whether they're going to overdiagnose, right? Because that's a problem too. Overdiagnosis and overtreatment is a problem too. Now, not in an area where we don't have medicine right now, but it would be if you give them something, they're going to, if your positive predictive value is low and then you find something, you're all of a sudden going to be treating something that may not be real. So I just don't think there's enough knowledge about it yet. It will get there eventually. But
some of the things that you're looking forward to discussing this fall, I know some of the things we don't know because we do breaking news sometimes and discuss, but we're looking forward to having more guests on.
Yep.
But what are some things in medicine, maybe in the later half of 2025, you're looking forward to discussing?
Yeah, I mean, obviously anesthesia, there's still a big shortage in increasing costs and all that sort of stuff. So I think we'll probably have, several more discussions about the state of anesthesia.
I do want to talk about work-life balance.
Yeah? Okay.
No, I do.
Yeah.
Because I think, does it exist? Not really. But with any profession, right? It's not just with anesthesia. Yeah. It's not just with, medicine. I think, maybe talking to somebody about, what does that look like for a physician, right? Because every career is different.
Sure.
I could say I don't have a work-life balance.
Right.
You know?
If you own your own company, that's a whole different deal, right? So, I mean, maybe the anesthesiologist who just clocks in and clocks out and goes to work and doesn't have to worry about running a business, doesn't have to worry about being a medical director of a facility, there's probably work-life balance there. I mean, I probably have some degree of work-life balance, meaning that if I need to do, I need to go coach football every night this week.
You'll do it.
I'll be there, right? So, but that also means that I got to get up earlier, do more during the day, and probably do some work when I get home afterwards.
But you've also developed that seniority over the course of the last 20 years, right? I mean, so there is a little bit of, you kind of put your time in.
Right. I guess you would say I have work-life balance because my clinical work doesn't consume all of my time. And so I choose that balance, and on that work-life balance, I choose to do administrative work and run a business and do social media and all these other things. So, yeah, am I insanely busy? Yes. But does that mean I don't have work-life balance? No, because I'm not sitting in an operating room 80, 90 hours a week. Right?
And that's a choice.
Right, exactly.
Yeah.
So...
We'll discuss that. That's a good topic to discuss.
There's some of that. I think there's going to be continued push for direct primary care and basically cash pay.
Direct to consumer.
Yeah, direct to consumer stuff in medicine. AI is going to be a huge topic. There's going to be new stuff coming up. Probably every week we do a podcast, there's going to be new stuff coming up with AI. I think there's going to be a lot of stuff that happens in HHS. You just see, that just today they were talking about how They've put some restrictions on mRNA vaccines. So, I mean, we can talk about vaccines. I'd love to have a vaccinologist, somebody who studies vaccines.
You're asking the wrong person.
Yeah, that'd be
I would guess it's vaccinologist, but I don't know.
That would be great to have somebody on who could actually tell us about that. So
sure.
Yeah.
All right. Well, we're looking forward to another full season of Anesthesia Answered, Going Under, Anesthesia Answered with Dr. Brian Schmutzler. And, of course, we'll start these podcasts up in September. So September through the end of the year, and we're looking forward to partnering with Butterfly, of course, talking to somebody from Butterfly.
Oh, yeah. We'll have a couple of their people.
And maybe go out to their conference again next year, which was awesome. I know they have that yearly conference. So
And we'll eat some masa chips, too. Just a big shout out to
all right. Shout out to masa.
It's the new white corn flavor, so we got to try
Shout
it
out to Dr. Adam Cian, who we've got to have on the podcast again.
Yes, we do. Yes,
he likes these. So what is this one?
White corn.
Okay.
White corn chips.
I've never had one that's a bad masa chip.
No, yeah.
Oh.
Very good. You can hear the crunch.
That was a huge crunch, by the way. You pair these with some ground chicken or ground beef.
And some salsa.
Turkey. Man.
It's good flavor.
Good flavor. You could hear the crunch all the way from Pittsburgh.
All right, now I'm gonna close this up. So I don't want Dr. Cian to be mad about having stale masa chips.
Should I blame my wife? I think she's the one that leaves it open.
I wouldn't.
I want to be married by the end of the day.
Yeah, so. I would cut that part out of the podcast. I would blame it on me before you blamed it on your wife.
I'm not going to blame it on you.
Just blame it on me. They're my chips. It's fine.
Well, this has been Anesthesia Answered.
Going Under.
Going Under, Anesthesia Answered. With Dr. Brian Schmutzler on Vahid Sadrzadeh. We're brought to you by the Butterfly Network. We'll see you guys in a couple of weeks, full time until the end of the year, and football season starts up.
Yes, it does.
All right. We'll talk to you soon.